Have you ever heard the rumor that if an older man goes too long without ejaculating, he is actively putting his health at risk? It is exactly the kind of locker room advice that spreads like wildfire online, leaving countless men quietly panicking that they are unknowingly damaging their bodies. The reality of aging is that your sex drive naturally changes. Some men are widowed, single, dealing with erectile dysfunction, or simply not as interested in intimacy as they once were. Yet, many of these men wonder if they need to force themselves to ejaculate just to protect their prostate or preserve their testosterone. If you have ever carried these silent worries, I need you to know that you are absolutely not alone. Welcome back to the channel. I am Dr. Judy Geller, a board-certified urologist and pelvic surgeon. Every single day in my clinic, I sit with men who are paralyzed by these exact questions. Today, we are going to separate the unvarnished medical facts from the internet fiction. We are going to explore what your body is actually doing behind the scenes and what truly deserves your attention. Before we dive into the science, please take a moment to like this video and subscribe to the channel for more evidence-based men's health advice. And drop a comment below. What is the biggest myth you have ever heard about men's health after 60? Let us start by dismantling the biggest, most pervasive misunderstanding in men's urological health. Many people falsely believe that the male body operates like a pressurized tank. They imagine that semen simply keeps building and building until it becomes physically harmful if it is not released. That is an easy visual, but it is medically entirely incorrect. Your reproductive system is not an overflowing container. It is a highly efficient, well-managed biological workshop. While sperm is produced continuously inside your testicles, they do not just sit there forever waiting for a release. If they are not ejaculated, your body naturally breaks them down and seamlessly recycles their cellular components. It is a brilliant, self-regulating process that has been part of human biology since the dawn of our species. This means that going weeks or even months without an ejaculation does not create a dangerous, toxic buildup. Your body knows exactly how to maintain its own balance without you forcing anything. I see the relief wash over my patients when I explain this to them. They come into my office terrified they have ruined their prostate simply because they haven't been sexually active, and they are thrilled to learn that their anatomy is perfectly fine. Now, this does not mean ejaculation has absolutely zero relationship to your health. You may have seen headlines about research from organizations like Harvard Medical School suggesting that men who ejaculate frequently over many years have a slightly lower risk of prostate issues. But it is incredibly important to understand how to read clinical data. Those studies show a correlation, not a direct cause and effect. Men who remain sexually active into their later years almost always share other compounding healthy habits. They tend to exercise more, sleep better, manage their stress efficiently, and carry fewer chronic illnesses. Those foundational lifestyle factors are doing the heavy lifting for their long-term health. The evidence simply does not support the claim that skipping an ejaculation directly causes disease. If ejaculation happens naturally, is comfortable, and aligns with your personal life, it is a wonderful part of your overall well-being. But here is where the conversation takes a critical turn. In my clinical experience, older men become so obsessively focused on counting their ejaculations on a calendar that they completely miss the massive, flashing warning signs their body is actually sending them. The hidden issue that deserves your absolute, undivided attention is your vascular circulation. Healthy blood flow dictates your sexual function, your urinary health, your body's ability to heal, and your systemic energy. The blood vessels that supply your pelvic anatomy are incredibly microscopic, much smaller than the thick arteries feeding your heart. Because these pelvic vessels are so tiny, they act as the ultimate canary in the coal mine. They will show signs of clogging and vascular distress years before you ever feel a symptom of heart disease. Gradual changes in your erectile function are often not just getting older. They are vital clues pointing to untreated diabetes, high blood pressure, high cholesterol, or early cardiovascular disease. Imagine watering your garden with a hose. If that hose slowly becomes clogged with mineral buildup, the water doesn't stop all at once. The pressure simply weakens little by little. Your blood vessels behave the exact same way. That is why paying rigorous attention to your overall vascular health is infinitely more valuable than worrying about hitting a specific quota of ejaculations each month. Another massive point of confusion surrounds testosterone. Some men firmly believe that abstaining from ejaculation will make their testosterone skyrocket, while others fear that frequent sex will drain their hormone levels and leave them weak. Let me be clear, neither of these extreme ideas is supported by clinical science. Your testosterone naturally fluctuates throughout the day and gradually declines as you age. What actually destroys your hormone levels are tangible lifestyle factors: chronic sleep deprivation, carrying excess visceral belly fat, heavy alcohol consumption, and unmanaged stress. Your ejaculation frequency barely moves the needle compared to these massive metabolic disruptors. In fact, the psychological anxiety you carry about doing it wrong can cause far more sexual dysfunction than a simple lack of ejaculation ever could. When you are constantly stressed about your performance or your schedule, your body remains locked in a tense fight or flight state. This chronic tension restricts your blood flow, kills your desire, and makes maintaining an erection biologically impossible. Worrying about the myth actively creates the problem. Instead of forcing your body into a one-size-fits-all calendar you found online, pay attention to how you actually feel. Are you staying active? Are you sleeping well? Are you managing your blood pressure? Those questions tell us significantly more about your longevity than counting the days since your last intimate encounter. Before we finish, there is one critical boundary you need to understand: the line between normal aging and a medical red flag. A gradual, slow shift in your sexual function over a decade is a normal part of aging. A sudden, drastic change is absolutely not. If you experience a sudden onset of severe erectile dysfunction, sharp pain during ejaculation, visible blood in your semen, chronic pelvic pain, or an abrupt, total loss of libido, you must seek medical attention immediately. Do not write it off as just getting older. These sudden changes can be early warning signs of prostate conditions, severe vascular blockages, or hormonal crashes that require prompt intervention. One of the greatest tragedies I see in my clinic is men waiting entirely too long to seek help because of pure embarrassment. They suffer in silence for years, only to find out there were highly effective, practical solutions available to them all along. As urologists, we have heard and seen it all. You are never going to shock us, and you are certainly not going to embarrass us. Your health is worth protecting, and your quality of life is worth fighting for. Do not let internet rumors dictate your peace of mind. I am Dr. Judy Geller. Thank you for your time, your focus, and for trusting me with your health today. Take care of yourselves, and I will see you in the next video.